Welcome to Nova Health, a channel dedicated to helping you stay active, mobile, and independent as you age. Our goal is to provide simple, safe, and effective exercises designed especially for older adults who want to improve strength, balance, circulation, and overall health. At Nova Health, we believe that small daily movements can make a big difference over time. Many people think that pain, stiffness, or weakness are just a normal part of aging. But the truth is that the right exercises can help your body stay strong and mobile for many years. This channel focuses on easy-to-follow routines that you can do at home, without complicated equipment or difficult movements. Whether you want to improve leg strength, reduce joint pain, improve circulation, or move more confidently, these exercises are designed to support your daily life. Many people experience strange sensations in their feet and legs, but are not sure what is causing them. You may feel tingling, numbness, burning, or a sharp pins and needles sensation, especially at night or after sitting for a long time. Some people describe it as feeling like they are walking on cotton or sponges. Others notice that their feet feel weak, sensitive, or difficult to control when walking. These are common signs of neuropathy, a condition that affects the nerves, especially in the feet and lower legs. Neuropathy becomes more common with age and is often seen in people with diabetes, poor circulation, or long periods of inactivity. When the nerves do not receive enough oxygen and nutrients from healthy blood flow, they cannot function properly. Over time, this can lead to reduced sensation, discomfort, and even balance problems. Many people think this is just a normal part of aging, but in many cases, there are simple things you can do to help support nerve health and improve how your feet and legs feel. One of the most important things for nerve health is movement. Gentle movement helps improve blood circulation, and blood carries oxygen and nutrients to the nerves. When muscles in the feet and legs contract and relax, they also help stimulate the nerves and keep them active. This is why specific exercises for the feet and legs can be very helpful for people experiencing neuropathy symptoms. In this video, we will go through 4 simple exercises that can help stimulate the nerves, improve circulation, and support better movement in your feet and legs. These exercises are gentle, safe, and easy to do at home. Let's start with the first exercise. The first exercise focuses on the toes and the small muscles in your feet. These muscles are very important because they contain many small nerves that help you feel the ground when you walk and maintain your balance. When neuropathy begins, the toes and the bottom of the feet are often the first areas affected. That is why starting with toe movements can help gently stimulate the nerves and improve circulation in the feet. To begin this exercise, sit comfortably on a chair with your feet flat on the floor. Make sure your back is straight and your legs are relaxed. Start by slowly lifting all your toes upward while keeping your heels on the ground. You should feel the muscles on the top of your feet working. Hold this position for about 3 seconds. Then slowly lower your toes back down. Next, try the opposite movement. Keep your toes on the floor and gently lift your heels off the ground. Hold for about 3 seconds, then slowly lower your heels back down. This movement activates the muscles in your calves and the bottom of your feet, which helps stimulate circulation and nerve activity. After that, you can add toe curls. While keeping your heel on the floor, try to curl your toes downward as if you are trying to grip the floor with your toes. Hold for a few seconds, then relax. This movement helps activate the small muscles and nerves in the bottom of the feet. Repeat this sequence about 10 to 15 times. Move slowly and focus on controlled movement rather than speed. The goal is to gently wake up the nerves and improve blood flow, not to rush through the exercise. This exercise is very effective because it directly stimulates the nerves in the feet while also helping improve circulation. Over time, this may help reduce numbness, improve foot control, and make walking feel more stable and comfortable. The second exercise is called ankle circles. This movement focuses on the ankle joint and the surrounding muscles, which play an important role in both circulation and nerve stimulation in the lower legs and feet. The ankle is a key area where many blood vessels and nerves pass through, so gentle movement in this area can help improve blood flow and support nerve function. To begin this exercise, sit comfortably on a chair with your back straight and your feet slightly lifted off the floor. If it feels more comfortable, you can also perform this exercise while lying down. Start by lifting one foot slightly off the ground so that your leg is relaxed and your ankle can move freely. Slowly begin to rotate your foot in a circular motion. Make a large, slow circle using your toes, moving your foot clockwise. Try to move only your ankle while keeping the rest of your leg still. The movement should be smooth and controlled, not fast or jerky. As you rotate your ankle, you may feel the muscles around your ankle and lower leg gently activating. Continue making circles for about 10 rotations, then reverse the direction and rotate your foot counterclockwise for another 10 rotations. After completing one foot, switch to the other foot and repeat the same movement. While doing this exercise, focus on slow and controlled motion. The goal is to improve mobility in the ankle joint and gently stimulate the nerves in the feet and lower legs. This movement also helps improve circulation because the rotating motion helps move blood through the small vessels around the ankle. Repeat this exercise for 2 to 3 sets on each foot. If you feel stiffness, move slowly and stay within a comfortable range of motion. Ankle circles are very helpful for people with neuropathy because they improve joint mobility, increase circulation, and stimulate nerve endings in the feet. Over time, this may help reduce stiffness, improve balance, and make walking feel more stable and controlled. The third exercise is called heel-to-toe raises. This movement is very helpful for people with neuropathy because it improves balance, strengthens the lower legs, and helps stimulate the nerves in the feet. It also improves circulation by activating the calf muscles, which help push blood back up toward the heart. This exercise may look simple, but it is very effective when done slowly and with control. To begin, stand upright near a wall, a chair, or a table so you can hold on for balance if needed. Place your feet about hip-width apart and keep your posture tall. Start by slowly lifting your heels off the ground so that you are standing on your toes. Hold this position for about 2 to 3 seconds. You should feel the muscles in your calves working as you hold yourself up. Next, slowly lower your heels back down to the floor. After that, gently lift your toes off the ground while keeping your heels on the floor so that you are rocking back onto your heels. Hold this position for 2 to 3 seconds as well. Then slowly lower your toes back down to the floor. This forward and backward rocking motion helps activate different muscles in the lower legs and feet. Repeat this movement about 10 to 15 times. Move slowly and focus on balance and control rather than speed. If balancing is difficult, keep one or both hands on a chair or wall for support. This exercise is very effective because it activates the calf muscles and the muscles in the front of the lower leg at the same time. These muscles help pump blood through the legs and also stimulate the nerves in the feet. Over time, this can help improve circulation, reduce numbness, and improve balance, which is very important for preventing falls and walking safely. The fourth exercise is called seated marching. This is a gentle but very effective movement for improving circulation and stimulating the nerves throughout the legs. Unlike exercises that only focus on the feet or ankles, seated marching activates larger muscles in the thighs and hips as well. This is important because strong, active leg muscles help pump blood through the lower body and support better nerve function over time. To begin, sit on a sturdy chair with your back straight and both feet flat on the floor. Place your hands lightly on your thighs or hold the sides of the chair for balance. Make sure your shoulders are relaxed and your body feels stable before you start. The goal of this exercise is to create a smooth marching movement while remaining seated. Start by slowly lifting one knee upward just a few inches off the chair or floor, depending on how high you can comfortably raise it. Hold the leg up for a second, then slowly lower it back down. Next, lift the other knee in the same way. Continue alternating from one leg to the other, as if you are marching in place while sitting down. Try to keep the movement steady and controlled, without leaning too far back or using momentum. As you continue, focus on the muscles in your thighs and hips doing the work. These larger muscle groups play an important role in blood circulation because each contraction helps move blood through the legs more efficiently. This also brings more oxygen and nutrients to the nerves, which may help improve how your feet and legs feel over time. Perform seated marching for about 30 to 60 seconds at a comfortable pace. Rest briefly, then repeat for 2 to 3 rounds if you feel able. If you are just beginning, you can start with shorter intervals and gradually increase the time as your endurance improves. This exercise is especially helpful for people who spend a lot of time sitting or who find standing exercises difficult. With regular practice, seated marching can help improve circulation, reduce feelings of heaviness in the legs, and support better coordination and mobility. Over time, it may also help make walking feel easier, steadier, and more comfortable throughout the day. Neuropathy in the feet and legs can be uncomfortable and sometimes worrying, especially when you experience numbness, tingling, burning, or weakness. While these symptoms can have different causes, one important factor that often helps is improving circulation and keeping the nerves active through gentle movement. The 4 exercises we practice today are simple, but they are designed to target the feet, ankles, and legs in a way that supports both blood flow and nerve stimulation. It is important to understand that nerve health usually improves slowly over time, not overnight. The goal of these exercises is to gently stimulate the nerves, improve circulation, and keep the muscles in your feet and legs active. When these areas receive better blood flow, the nerves receive more oxygen and nutrients, which may help reduce discomfort and improve sensation gradually. Try to practice these exercises for a few minutes each day. You do not need to move quickly or force any movement. Slow, controlled motion is more effective and safer for your joints and nerves. If you feel pain, stop and rest. With regular practice, these small movements can make a meaningful difference in how your feet and legs feel, helping you move more comfortably and confidently each day.